Stop rubbing your eyes. It feels harmless. Almost everyone does it. You're tired. Your eyes itch. You press your fingers against them for a few seconds, and suddenly everything feels better. But what if that tiny moment of relief is putting one of the most delicate parts of your body under enormous mechanical stress? Your eyes are not glass marbles. They are living, pressurized organs filled with clear fluid. Every time you press on them, even gently, they temporarily change shape. Most of the time, they recover within seconds, but sometimes they don't. And for millions of people around the world, a habit that feels completely normal may contribute to a disease that permanently changes the way they see. Your vision depends on a transparent dome at the front of your eye called the cornea. It looks simple. It isn't. The cornea is made from incredibly organized layers of collagen fibers. Those fibers must stay perfectly aligned to keep the surface smooth. Even tiny changes in its shape can bend light differently, making the world look blurry, stretched, or distorted. That perfect shape is one of the greatest engineering achievements in the human body, and it's surprisingly fragile. So why does rubbing your eyes feel so good? Because your brain rewards it. Pressure around the eyes activates nerves that can briefly reduce discomfort and create a feeling of relaxation. If your eyes are dry, irritated, or itchy, rubbing them can feel almost irresistible. But your eyes don't know you're only trying to feel better. They only experience force. Imagine pressing your thumb into a water balloon. The balloon changes shape instantly. Your eye behaves in much the same way. Normally, that temporary deformation disappears. But if you repeatedly apply force over months or years, especially if you rub your eyes hard or frequently, researchers believe that mechanical stress can contribute to weakening the cornea in some people. That's where a condition called keratoconus enters the story. At first, it's almost impossible to notice. Words become slightly less sharp. Night driving feels a little harder. Streetlights suddenly have glowing halos around them. You assume you need stronger glasses. But new glasses don't solve the problem. Because the problem isn't your prescription. The problem is that the window at the front of your eye is slowly changing shape. Instead of remaining smooth and round, the cornea gradually becomes thinner and begins to bulge outward into a cone. A camera with a bent lens can't produce a perfectly clear image. Neither can your eye. Doctors first described keratoconus more than 170 years ago. For decades, nobody completely understood why it happened. Genetics clearly played a role. Some families were affected much more than others, but another pattern kept appearing. Many patients had one habit in common. They rubbed their eyes again and again and again. Modern research suggests that repeated eye rubbing is one of the strongest modifiable risk factors associated with the progression of keratoconus, especially in people who are already genetically susceptible or who have allergies that make their eyes constantly itch. That doesn't mean everyone who rubs their eyes will develop the disease. Most people won't. But if someone is vulnerable, years of repeated mechanical stress may help push the cornea beyond its limits. And once that happens, there is no button that returns it to its original shape. This is why eye doctors take chronic eye rubbing surprisingly seriously. The symptoms often appear slowly. Straight lines begin to look slightly bent. Bright lights spread into large halos. Reading becomes exhausting. Vision changes more often than expected. Eventually, ordinary glasses may no longer provide clear vision. The shape of the cornea itself has changed. When the disease progresses, treatment becomes much more complicated than simply getting a new prescription. Some patients wear large, rigid scleral contact lenses. Unlike normal contacts, these lenses don't sit directly on the damaged cornea. Instead, they rest on the white part of the eye and create a smooth optical surface that can dramatically improve vision. Others undergo a procedure called corneal cross-linking. Doctors place riboflavin eye drops on the cornea and then expose it to carefully controlled ultraviolet light. This strengthens chemical bonds within the cornea, helping slow or stop further weakening. The goal isn't to restore perfect eyesight, it's to keep the condition from getting worse. And if the disease becomes severe enough, some patients may eventually need a corneal transplant. That's why prevention matters so much. The strange part is that many people don't even realize how often they rub their eyes. They do it while reading, while working, while watching television, even during sleep. The habit becomes automatic. If your eyes itch frequently, the better solution is to find the cause instead of constantly rubbing them. Allergies can often be treated. Dry eyes can often be managed. Artificial tears may provide relief when recommended by an eye care professional. Sometimes simply blinking several times or washing your face with cool water is enough. Your eyes work every second of your life, from the moment you wake up until the moment you close them at night. They allow you to recognize faces, read books, watch sunsets, see the stars. They're incredibly powerful, but they're also incredibly delicate. The next time your eyes start to itch, remember what's happening beneath the surface. Remember the perfectly organized collagen fibers holding your cornea together. Remember that a habit lasting only a few few seconds can be repeated thousands of times over a lifetime. And while most people will never develop keratoconus, protecting your eyes is one of the easiest investments you can make in your future vision. Because once your eyesight changes, you'll wish you'd appreciated just how fragile it always was.